Let's get more on this now with Dr. Bharat Pankania, who joins us from Bath in the UK. He's a senior clinical lecturer at the University of Exeter's Medical School. Good to have you back on the program, Doctor. As we heard there, the UK has become the first country to approve Merck's COVID-19 antiviral pill. It's been described as a potentially game-changing treatment in terms of the pandemic. Do you agree? And how does it work exactly?
So it's not a game changer. It is a new additional tool in the battle against COVID and preventing deaths, but it's definitely not a game changer. The game changers are the vaccines and infection control measures. How it works is that it interferes with the reproduction of the virus. So as the virus is replicating, it makes mistakes, and it makes so many mistakes that the end result is it is a useless end game for the virus. It doesn't live, it's just made too many mistakes. That's how the drug works. It is safe, but it is not an absolute game changer.
Interesting. So from what you've just said there, it's not really an alternative to a vaccine, is it?
Not at all. And prevention always wins. So in my advice to anyone anywhere in the world is, please get yourself immunized. It will stop you from severe disease and death. The tablets and things that are now coming out are a useful additional tool were you to get infected. So the molnupiravir, the new drug from Merck, only works in early disease, i.e. mild disease, and in 50% of cases. So we still need that protection, and that protection comes from vaccines.
And a day after the UK approved Merck's antiviral pill, Pfizer has come out and said that its own version of the drug cuts the hospitalization rate of COVID-19 patients by nearly 90%. How similar are the two treatments?
I don't know much about the Pfizer medication, but I would conjecture that the nucleosides that are being used are also deployed by Pfizer, in that they make the virus make mistakes, and then the virus can't infect and cause illness. So that's what it is. But I repeat, the key is to get immunized, to protect yourself, to prevent yourself from severe illness.
Now, all this comes as the World Health Organization issues a dire warning. They're saying that up to 500,000 people could die across Europe and Central Asia as virus transmission rates spike in the region. What needs to be done to tackle this? Are we looking at perhaps another wave of COVID-19 in the winter?
Yes, it's very worrying. The numbers from European Union, they are on the rise. And in countries where they've had poor uptake of the vaccines, the case numbers are significantly higher, as are the deaths. So strategy number one would be, in the countries where you've got poor uptake of the vaccines, you really must hurry up and immunize your people. Secondly, of course, we've got influenza. So we need to also immunize against influenza as soon as possible. And then the third bit is reduce your interactions with other human beings, especially as we've got the Delta variant, which is more infectious. So in that situation, I always advise wear a mask, wear a good quality mask, an FFP2 mask.
Yes, and because we know authorities in various countries around the world, including the UK, have relaxed some of those prevention issues, such as mask wearing indoors and on public transport. I know that is the case in London, for example. So would you urge authorities to reinstate them right now?
Absolutely, it's well overdue, and it is a minor inconvenience compared to the clear, and now it is absolutely clear scientific evidence that a good quality mask, well worn, reduces transmission of infections. This is an aerosol spread infection, and we can do our bit by getting the politicians to do a U-turn in the United Kingdom and say it clearly on public transport in crowded places. Wear your mask, wear a good quality mask, wear it properly.
Okay, Dr. Bharat Pankania, always really good to get your analysis. Thank you so much again for joining us.